Welcome to Distance is No Obstacle, the medical education podcast aimed at providing bite-sized education and information for doctors working in rural and remote Australia. Today we chat with McPhilimey, a senior respiratory and sleep scientist at Cardio Respiratory Sleep and an independent healthcare consultant. This is the first of two podcasts. Thanks so much for joining us today. Now we're starting with the very basic question of why do we sleep?
It's actually more complex than actually people think. So people think just that sleep is just rest and it's just conserving energy, but there's many reasons to why we actually sleep. And if I'm to list four of them, the first one actually is it was originally a survival mechanism. As an animal out in the wild, we'd have to hide away and keep as quiet as we can to hide away from predators. That's not such an issue now, but that was one of the main reasons that we originally did. And then there is the as we did hide away, you can kind of lower energy levels, so you can then go out and you can focus on catching your prey when you're out and the animals. That's what would be happening in the animal kingdom. As we've now evolved to actually allocate the energy into different areas of the body. So particularly sleep is all about energy allocation rather than reserving energy. So as we actually sleep, we are focusing that energy on the immune system, repairing the body, essentially balancing that nervous system so that we can recover from the daily activities. Whereas the wakefulness, the energy is more to do with the activity and the jobs that we can do and firing up the brain so that we can, go out and do our daily jobs.
Now, what is sleep?
It could be labelled as three different things, really. So it's a brain state. So we've got different brain waves that are occurring throughout the day, and then when we sleep, we go into different patterns of brain waves depending on the depth of sleep we get into. It's also a behaviour. Obviously, it's something that we should be doing every night. It should be familiar, and it's also a process that we undertake as well.
How is sleep controlled?
Interesting question. So with sleep, there's two ways that we actually are able to get to sleep. Now, there's a sleep initiation phase. So throughout the day, we're expending energy, and that energy comes from a molecule called adenosine triphosphate. That's the universal molecule that we all use. Now, when that's broken down, it breaks down into just pure adenosine. Now, what adenosine does is it kind of builds up this pressure to sleep. So at night time, when you're starting to feel dazy, you might not be able to focus on things as much as well as you can do. That's a build-up of adenosine in the brain. So that's what causes the sleep. But it's controlled by the sun and light. So we're on what's called a circadian rhythm. Throughout the day, as it's bright, we've got a release of cortisol, an increase in the sympathetic nervous system. And what that actually does, it allows us to be alert. Now, as nighttime comes and it becomes dark, we actually start to get this release of melatonin into our brain. Now, melatonin it peaks around about midnight, and that actually helps initiate sleep and allow us to change our brain waves so that we can get into a level of different consciousness.
So generally speaking, how much sleep should we get?
We should always be aiming to get between the 7 to 9 hours. That's what all the literature suggests. There's probably about 1% of the population that will probably survive on less without either having performance impacts of how you're feeling or how you're able to work throughout the day. And when you start to get less than 6 hours into the 5 hours, you're actually going to start to have detrimental impacts on your body and your physiology and even your psychology. So aiming from that 7 to 9 hours. And that depends on how you feel. There's no particular label to say that you need to get 8, you need to get 7, you need to get 9. If you're waking up in the morning and you feel as if you are struggling to turn your alarm off and you're having to snooze very, very often, that's probably your body telling you that you either need more sleep or the quality of that sleep isn't good enough, and then we need to have a look at that.
What are the clinical impacts of poor sleep?
What we've got to remember with sleep is that sleep actually controls every physiological component in the body. So it's essentially balancing out the nervous system. So in the nervous system, you've got sympathetic nervous system, which is it's making you more alert, and then you've got the parasympathetic nervous system, which is dedicating time to relax and slow down digestion and to recover the body. Now, what happens is when we don't get enough sleep or the quality of that sleep is poor, we actually get what's called sympathetic overdrive. Okay, now this can have an impact on the heart because obviously the heart's not getting the rest it needs because the heart is constantly being stressed when you have a lack of sleep. And so we can see there's a huge link between having poor sleep or lacking sleep in cardiac issues. So you've got things like just cardiac disease in general. We've also got cardiac issues with cardiac arrhythmias. And then you've got the metabolic side of things. So what actually happens in the body when you have a lack of sleep, because of this sympathetic overdrive, you get an increase in the release of sugars into the blood. So your blood sugars rise, so therefore you get a decrease in insulin sensitivity, increased risk of type 2 diabetes, weight gain. And if you look at it from a psychological aspect as well, so there's a physiological side, but there's also the psychological side. So we actually get a change in our brain waves. So we get, it's not brain waves, so our brain chemistry. So you might get a lack of serotonin, so increased risks of things like depression, anxiety. We get alterations in the dopamine receptors. And dopamine is what we need for our like it's our reward system essentially. So, for example, if you were to if you were to go and look for some food and you can consume some food that you enjoy, nice palatable food, you would get a release of dopamine to say that's nice and to continue to do that. What actually happens when you have poor sleep or you have something like obstructive sleep apnea, those receptors that receive that adenosine are altered. So therefore you don't actually, what actually happens is you don't get that the feeling that you would if you were to normally consume those foods. So therefore you need to reach for more food. So you actually, your risk changes. So for example, it increases the risk of addiction because you're more likely to gamble, you're more likely to take higher risks and see them as low risks because of these alterations in the brain. So it not only changes the physiology, it changes the psychology. And when it comes to, if we've got a huge issue with obesity all around the Western society at the moment, and we actually get changes in the hormones that regulate our appetite when we don't have sleep. So, for example, if you're only sleeping for 4 hours or you've got obstructive sleep apnea, you're going to get changes in what's called ghrelin and leptin. They regulate our appetite. So ghrelin increases and leptin decreases. And ghrelin is what makes us feel hungry. So if you've ever, you maybe had a lack of sleep, the next day you find yourself just reaching to the cupboard for sugary foods, research suggests that actually that's because of these changes, not only in the brain chemistry, but also in the hormonal changes within the body as well.
So if a patient does present to a GP with sleep issues, what's the next step?
The first thing that you could actually do you can obviously make behavioural recommendations. So there's always some value that a GP can give immediately, and that is to just make sure the patient is going to bed on time, looking at their stress levels, seeing if they have any current issues within the family or that could be causing some kind of stress. However, if you think it's a clinical issue, and that is going to be it could be anyone at the moment, in fact. So obstructive sleep apnea always there's a typical label of people who are overweight or men that are overweight over the age of 45, and they're at the biggest risk factor. But there is to get a sleep study now, you actually, in Australia, you actually have to go through a process of what we call the OSA 50 and the Epworth Sleepiness Score. And that's just assessing risk for obstructive sleep apnea. And that was brought in November 2018. So you can find those on our website, so on sleepcrs.net.au. If you go to the doctor's referral section on there, you'll actually find those questionnaires that you can fill out. And if, for example, on the OSA 50, if they score greater than 5, and then on a Epworth Sleepiness Score greater than 8 or greater, they can then be referred directly for a sleep study. So then you just have to fill out the referral and send that into, for example, either Cardio Respiratory Sleep or another provider out there. But if they don't quite meet that, they would actually have to then see a sleep specialist first, and they would then make the referral. So obviously this podcast is out for GPs out in the rural areas. We can still make arrangements. If a patient can get down to Perth, we would love to take them into the sleep lab. If they've got private health insurance that covers them, usually if it's a silver or gold health fund, they're covered for an in-lab sleep study. And if they're not, then we actually can do home-based sleep studies. Being in that the majority of this audience is probably going to be a few thousand kilometres away, or at least a few hundred kilometres away, you'd probably have to try and source a local provider to look for a sleep study. However, the majority of the sleep studies out there that are pharmacy-based are only what we call level 3 or level 4 sleep studies. So the depth and accuracy of those studies is more of a screening tool. So if you are looking at someone with multiple comorbidities, they might have cardiac issues like we've just discussed, they might have metabolic issues, or they might have some kind of psychological issues that are related to anxiety and depression, you're going to want a more in-depth sleep study. So it's worth them maybe making the trip back to Perth. And if there are people who, if there are GPs out there that are struggling to find a specialist or someone to discuss, then there's the potential always that we can get a phone call or a video conference or something like a Zoom or a Skype call with one of our specialists, or like someone like myself, to have a discussion with you guys to see what's the best course of action.
So what can GPs be doing to ensure patients have good sleeping habits?
So GPs can always, obviously you're doing the investigation, you're doing referral if you think there's an issue, but we can always look at the behaviour of sleep. So we know that sleep is something that we have to do every night, but as it's controlled by the sun and light, or the light and darkness, we can ensure that the patient in front of you is actually starting to prepare themselves when they go to sleep. So when the light starts to going down, we're dimming down the lights and we're keeping our sleep schedule consistent. Okay, so the main thing is that we're getting up at the same time in the morning. So if you're getting up at the same time in the morning, we're actually the adenosine that builds up from the breakdown of using energy throughout the day, like I say, that actually increases the pressure to sleep. We're getting the same amount of build up in this adenosine. So roughly around about the same time at night time, we're going to start to feel as if we are tired. So if we keep it consistent, consistency is the key, because our body wants that. The hormones in our body, the chemicals in our body, and even just we're meant to be naturally controlled by this light. So the number one thing we're looking for is, as the individual, got consistency. Then we're probably going to be looking at are they taking naps throughout the day? If they are taking naps throughout the day, ensuring those naps are not later on in the evenings, because that reduces this pressure to sleep, and those individuals then won't be able to sleep at night time. So alcohol, there's a bit of a misconception around about alcohol. The most common conception is that actually people might need a few drinks just to relax at night time, a couple of glasses of wine or a few beers, and that's looked upon within the population as a common thing to do just to settle down and sleep. But what alcohol actually does is it disturbs the chemistry in the brain. So we actually originally we get like a depressive effect. So yes, we start to feel more sleepy, but throughout the night, we get this what's called a rebound. So then we actually get like a bit of an excitatory effect. So it actually fragments the sleep, and it causes a poor sleep quality. So even though people think they have a few nightcaps to go to sleep, then it's actually not. It's the quality of sleep they get in is poor. So looking at things like alcohol intake before bed is another recommendation that I would make. And technology is also a huge one nowadays. So if we're looking at how sleep is controlled, so as light goes through the eye, you actually get a stimulation in cortisol. Phones and iPads and computer screens, they have blue light, and blue light is the worst light for stimulating that effect and making us more wakeful. And we know that blue light can probably delay our onset of sleep maybe for 3 to 4 hours. So if you're sat, and typically quite a few, especially young individuals, are on their phones maybe to 2 to 3 hours before they go to bed with it right in front of their face, their time phrase of what they're sleeping could actually potentially be in a different country, because you're shifting their sleep phase to such an extent that they might not have their peak of melatonin till 3 or 4 o'clock in the morning, and then all of a sudden they're saying, why can't I sleep? And it's actually because the behaviour around that sleep. So number one, be looking at consistency. Number two, following the dark and light, dimming down the lights at home as soon as the sun starts to settle, even using natural light sources, so things like candles and stuff, that can really help. And then number 3 would be technology. Technology is getting better in terms of reducing blue light. The night mode dims the screen, so it's going to be better than not having it. However, if it was to recommend that people, especially people got businesses or they have to work in the evenings, then looking at blue light glasses. So you can actually get glasses that actually absorb the blue light, and that can actually, research suggests that actually they're helpful. Another thing that I'd be looking at is the amount of caffeine that actually individuals are consuming. So obviously we live in a society where it's more 24/7 now. I don't know if from rural it's very similar or not, but the more stress there is, the more people are having to consume stimulants and caffeines and things like that. So caffeine actually acts on the brain by reducing the amount of adenosine within the brain, so it actually excites us. Now caffeine can stay in the body from a half-life of maybe 6 to 7 hours, so you can have a coffee at 3-4 in the afternoon, and still when you're trying to get to bed at 8-9 o'clock, you've still got a small amount of caffeine in the body there, and that's going to alter or reduce the ability to be able to get to sleep.
So no drinks or no caffeine as a nightcap.
Yes, obviously people work and sleep. Not many people like them for giving this advice, but if you have got poor sleep out there, the first thing I would always do is just see if you can remove caffeine, remove alcohol before you go to bed, and just see what effect that has on your sleep quality.
So if the patient passes the test and is sent on to the sleep study, how much does it cost?
So this is dependent on whether they have a health fund. So if they have a health fund that covers them for in-lab sleep study, then Cardio Respiratory Sleep there's a no-gap fee, unless there's an excess on your health fund, which obviously would have to be paid. Now, if it was a study where they were actually to be set up and then maybe go to a hotel here or go back to a room where they're taking it home, for example, then our upfront costs would be around about $435 to $455, but they get the majority of that back from Medicare. So you're looking at an out-of-pocket expense between $120 and $150, depending on whether you're a pensioner or a private patient.
So once a patient actually does have a treatment plan in place, how quickly do we see results?
It's actually the million-dollar question that people always ask. Obviously, the patient instantly wants to know, okay, what's my expectations? Now, I like to set expectations that are real. One patient might wake up the next day and feel great and feel amazing, and that's it. Instantly, they're hooked onto CPAP and gone, this is amazing. But some individuals, they actually don't feel it straight away, and it takes a little while for them to get used to it. Now, every individual is different, so I can, to a certain extent, predict some individuals, just because I've been doing this for 8-9 years now. Usually, if you have very vast symptoms and the severity is very high, within a few days of getting solid usage, and I can discuss the solid what usage is. So typically for an individual to get benefits from CPAP therapy, they need a minimum of 4 hours. That's an arbitrary rule. Now, Cardio Respiratory Sleep, because we're the population that we're treating is mainly people with comorbidities, we like to actually push that up to more to 6 hours per night. And there's reasons for that, because we actually have REM sleep later on in the latter half of the night, so in the early hours of the morning. When we're in REM sleep, we're actually at our most relaxed, and when we're at our most relaxed, the airways are most likely to collapse, and therefore you have more of these apneas. So if you're only treating an individual for 4 hours and you've got another 4 hours of sleep, most of their apneas might occur in that latter half of the sleep, so they're still getting all those drops in oxygen, the deprived oxygen state in the brain and the body, so they still have that, so they might not get the benefit. So we aim to push up to 6 hours, but that's the level of standard that CRS does. In terms of expectations, there are some individuals that actually don't feel a benefit. Now, this is the question that I've been asking myself for a very, very long time now, and I'm trying to figure out what the problem is. But there's a group of typical patients out there that, let's say, are very driven, very motivated, and very focused on what they do. Okay. Now, they might not have much time to reflect on their awareness of what they're feeling. So we do see very typical businessmen, CEOs and people like that who go on to CPAP therapy, and they don't exactly feel the difference, because what actually happens, what I predict that happens with those individuals, is that energy just instantly already goes into extra work. So rather than those individuals reflecting and saying, actually, am I less tired? No, you're more productive. You're able to do more, so therefore unconsciously you just do more, because that is just your personality. And if it's chronic, so obstructive sleep apnea often doesn't get picked up immediately. People just feel tired. They go, okay, this is just a part of aging. This is just how I feel. And what happens is we actually get a shift in how our nervous system works. So if we're to go being into the science of it, there's actually a nerve called our vagus nerve in our body, and that nerve has 80% of that nerve has these endings that are scattered all around the body that are to detect how our body's feeling. So it's given us body awareness, and it's also given us self-awareness. Now, when we're in a sympathetic overdrive, we discussed that earlier, so we're getting a reduction in our airflow, we're getting a decrease in our oxygen levels, we get sympathetic activity. When that happens chronically, we get a decrease in this sympathetic nervous system. The vagus nerve actually is what is controls the parasympathetic nervous system. So we lose control of this vagus nerve. So all those endings, all those nerve endings that are telling us how body aware and self-aware we are, they stop receiving the signals and send it to their brain. So people actually become less self-aware and less body aware. So people don't go, okay, well, I actually don't feel tired. But they might have 30 to 40, 50 apneas a day. But it's like they don't notice a difference. I don't feel a difference. Now, if I was to look at a longitudinal study, whether CPAP improves that, there's no evidence out there because they haven't done those studies yet. But what we do know is that those individuals are still going to be getting the oxygen levels they need. They're going to be keeping their airways open. And under the scenes or behind the scenes where they're not actually feeling it, there is a protective mechanism of these devices as well.
And the question everyone's probably asking is, how long do we have to use the treatment for?
This is an interesting question because this is where it starts to get a bit complex in terms of it depends on the treatment modality, and it depends on the severity and the cause. So there's many causes it could be. Number one, the main cause is going to be obesity. So yes, if an individual is motivated to be able to go out and change all their habits, which is very difficult, then they can probably lose weight, and they're going to reduce the amount of apneas they're having because they're going to have less weight around their neck and less weight on them in general. So they're going to improve their breathing. And I would always recommend, and anyone should recommend, if someone's overweight, obviously behavioural therapy and modifying diets and all that sort of stuff. So that is always the first recommendation. But the fact is that if you have obstructive sleep apnea and you don't treat it, then, like I've already discussed before, you've got changes in your appetite. You're physiologically and hormonally less likely to be able to lose weight. So therefore, it's more difficult to actually do that. Number one, making the choices. Number two, physiologically in the body, the hormones just not there, or not. The alterations in the hormone make it less advantageous to be able to lose weight. So, in general, the most common thing is that actually CPAP therapy is probably going to be a long-term thing. If it's only mild or mild to moderate and it may be just on your back and someone recommends to use CPAP therapy and you were to lose 5, 6, 10, 15 kilos, you might get to a point where your apneas are low enough or you don't feel you get energetic changes and you don't feel as tired, so you don't have to use it. But on more the severe ends, then it's more likely going to be a long-term thing. And that's where people then get upset and get, okay, well, I'm a bit... they've gone 30, 40 years without having to use it. Now I've got to use this for the rest of my life. The majority of people that use it and get the successes, it's worth those. It's worth that initial fear. It's worth stepping into that and going, you know what, I'm going to bypass that. I'm actually going to give this a try, and I'm going to really take a good shot. Now, if I'm to talk about success stories, one of my favourite success stories is having a guy who's 150 kilos, very, very tired. He was a truck driver, very typical for obstructive sleep apnea. He was coming into me and he's like, Martin, look, I am. My life is a bit of a mess at the moment. I can't really work. I can't function. I'm on the verge of losing my job, my career. This is the clutches. This is me just clutching that. I've got an issue. Comes for a sleep study. 120, 130 apneas per hour. Trial CPAP, he's on CPAP therapy, and within 2 weeks he feels like a changed man. He feels 10 years younger. He's coming into me, this is a 50-year-old guy coming into me crying with happiness to say, I found this answer. A year later, I hadn't seen him for a year. We do reviews 6 months, 12 months. I didn't catch up with him 6 months. In 12 months' time, he'd lost 30, 40 kilos. He's got himself a dog. Him and his wife are really happy now. They're going outside walking. He's a changed man. And that's one case, but this happens to many, many patients. So even though it could be a long-term perspective, it's that long-term of your quality of life that you need to look for.
So where can people go to for more information on sleep treatments?
So I actually work for a company here in Perth called Cardio Respiratory Sleep, and we're a company that we focus on high quality patient healthcare to get the best outcome for the patient. And we have a lot of information on our website, so you can go on to www.sleepcrs.net.au, or if you actually wanted to contact me directly by email, I'm actually happy to people to contact me. That's fine. That's Martin.McPhilimey, McPhilimey @sleepcrs.net.au.
Thanks so much for joining us for podcast 1, and podcast 2 will be covering more of sleep apnea, I understand.
Yeah, no, thanks for having me on. It's been really great to talk, and I hope that the GPs and anyone listening out there in the role has got something from this. And check out podcast number 2, because we go a bit more into obstructive sleep apnea.